So a public health official, especially in light of the new high counts there today, public health officials have sort of flagged such issues as dense housing and essential workers as key to the high counts in the Fraser Health region. But these are presumably relevant to other parts of BC. So, are there more essential workers in Fraser Health, more dense housing? What's making these high counts so distinct? What explains these high counts?
Yeah, so there's a variety of things. We know that the highest population base is in the lower mainland, particularly how we've broken it up by health region. The largest health region by population is Fraser Health. It's a younger population with larger numbers of families and children. The vast majority of our schools, by a large amount, the highest numbers of schools are in the Fraser Health region. We have lots of families that work in that live in multi-generational homes. There's cultural reasons why people come together, why it's so important to have community together in large numbers. And I know many of my colleagues and friends who are from South Asian community, for example. Having 200 or 300 people as your immediate family is normal and is important and is part of how life is lived. And these are things, unfortunately, that this virus can exploit. It doesn't recognize who we are, but it recognizes that when we're in crowded situations indoors, that we can pass it on. And from the very beginning, we have said that this virus is transmitted most often to the people we are closest to. So we are seeing some of that effect. We also know that many of those high-risk high-risk businesses, like essential businesses, like our food processing plants, like fruit warehousing, all of those places are in the Fraser Valley. Poultry plants. We know that much of the trucking industry, people live there, and many of our essential workers, healthcare workers, in Vancouver Coastal live in the Fraser Health region. So there's a whole variety of reasons why we are seeing increased numbers there. We knew that was likely to happen, but we had that rapid increase in the middle of October. That was a whole bunch of different issues coming together at once. It was social gatherings, it was the fact that this virus was being transmitted, that we were having things indoors. So I think right now we're seeing that reflected in a smaller scale around the province, and we all need to pay attention to the things that we can do to stop our social interactions, to put the brakes on this virus now.
And I suppose one thing further to remember that, and I very strongly believe this, I know Dr. Henry does as well, that we're all in this together. And there was a time early in the pandemic when more of the cases, even though Vancouver Coastal Health was smaller, were in Vancouver Coastal Health. In the reverse of what we say about Fraser Health, which is its BC's youngest population, also has an impact on other health authorities. Vancouver Coastal Health has essentially the same number of people who have passed away as Fraser Health, even though it has significantly fewer people. In the middle of the summer in Fraser Health, a disproportionate number of our cases within Fraser Health were in the Abbotsford area. Now it's in Surrey. But we have cases throughout the province. And just to put it in context, I think the number of cases today outside of the Metro Vancouver health authorities is 51. Well, 4 weeks ago, that averaged about 4 or 5. This pandemic is everywhere. We need to support each other everywhere. And that is right now particularly true in Fraser Health. But these circumstances can change in communities, and it shows why the steps we have to take in Fraser Health today need to be taken everywhere, and why it's so important, I think, and Dr. Henry made the decision today to extend the orders that were for Vancouver Coastal Health and for Fraser Health to the whole province. I live in Vancouver Coastal Health, 4 blocks from Fraser Health. That's an administrative distinction, but what it tells us, I think, what all of this information tells us is what a difficult pandemic this is, how difficult it is to manage this, and how we're all in this together, every single one of us.
Do you have a follow-up, Ian?
Yes. Are there any, given these numbers that are still consistently high, are there any specific or distinct strategies being considered to get things under control or the numbers down in Fraser Health? If yes, what? And if not, why not?
Yeah, so I've sort of announced all of those strategies that we're talking about. In particular, we're focusing on having our supporting our contact tracers in the Lower Mainland, so both Vancouver and Fraser Health, to get on top of being able to find people in a timely way, to make sure that we're catching, that we're understanding where the clusters are happening, getting on them quickly, and focusing on where we are seeing transmission happening. So having our, for lack of a better name, a rapid response team that one of my deputies will be supporting with the environmental health officers, focusing on where we are seeing transmission now in some business settings, focusing on what we've been doing all along, but enhancing our ability to protect our healthcare system, whether it's long-term care or acute care where we're seeing outbreaks happening. So there is absolutely an intense focus on that, but the measures that you're seeing today are the ones that we expect will work if we all do our part.
Just one statistical thing as well, Ian. We've transferred significant contact tracing capacity to Fraser Health, including 43 staff people from the Provincial Health Services Authority who do contact tracing to Fraser Health. Obviously, the largest share of the people we've hired are working in Fraser Health. Dr. Henry and I had a chance when we were in Surrey recently to see them do their work, and they're doing an extraordinary job. And I think we'll continue, obviously, as we have in the past, to focus resources where resources are needed. And so in terms of the significant amount of resources being transferred, obviously, in terms of the resources of the healthcare system, from contact tracing to primary care to support for hospitals, support for long-term care, obviously right now, Fraser Health is at the center of all that, although we have significant issues in all of the other health authorities.